Hi, my name is Jenny. I brought my son Austin, who's 6.5 years old, to visual therapy, the more intense one. The reason being is why we started this process of visual therapy is my son was diagnosed with a sensory processing disorder, roughly around 2.5 years old, and he also had a speech delay. And we've done early interventions, we've done many speech, OTs, food therapies. We've done so many things out of the book trying to get him where he needed to be, to learn how to have coping mechanisms for especially the sensory. And we've gone through the school process and everything with IEPs and then the 504 plan. Because lucky enough, he graduated out of the IEP, which was a good thing and a bad thing. We all know. So what turned us to visual therapy is that we, during COVID world, even everything that's so hard when everything shut down, Austin was diagnosed with ADHD and a specific reading disability. And so for me as a mom, I thought to go the speech route to see if he needed speech to help understand or the lingo. And then he did not need speech. And then I was referred to visual therapy. And I didn't even know that was a thing. I didn't even know it was out there. I had no idea. But I'm very thankful that we went this route and came and did the visual therapy. It's made quite an impact just in the 30 days, now over 30 days of this process. It is 2 weeks in person, and then we are at home doing some therapy with it as well. And you start with the results, and then you have end results. And it's just night and day seeing the results, but just not even the paper, but just seeing the results in Austin himself, being able to not be so sensitive and to be able to recover from if we get bumped or if we're not getting our way with something. He's able just to take a deep breath, and he understands that it's okay not to get your way. The other thing was huge for us is his focus. We were really concerned because he had so many wiggles, especially being at home e-learning and then the transition of going back in person. He was just wiggle, 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 wiggle that we weren't able to focus or even know what's going on in class unless my husband and I sat with him the entire time. And he's able to sit and able to find his paperwork in his folders now. He's able to do that. We still need breaks from time to time, but he's 6.5 and he's diagnosed with ADHD. He's a kid. But the process is night and day with him. So he's able to attend and not struggle so much to focus to what he needs to be achieving that task. The other night and day difference is the sleep. Austin, since he was born, was never a good sleeper. Still to this day, before the visual therapy, he would call my name 4, 5, 6 times before he would even fall asleep. And then he would get up every night, yelling my name, "Mom, I need you." And I would have to go get him, and he'd come and sleep in our bed. That has changed. He doesn't call my name before to go to sleep anymore 5 or 6 times. He doesn't call my name at all. And he does wake up from time to time, but we are 6.5 with very good imagination. But he does sleep, and he's not so crabby and so sensitive because we are getting the sleep now. So the visual therapy has been amazing process, amazing experience. The doctor, she's just wonderful. She listens to the patients. She wants to hear about the progress of everything, and she really cares. So I highly recommend going this route if you have a child that's struggling. Sorry, it's just been an emotional, good process for my family and myself and my son because I've seen such a good impact for him. That this is available, and I feel for parents that don't know that it's available. So if you can, take the time and research and come, because it has made quite an impact. So I highly recommend it.